welcome. This is a talk regarding mental health in schools. So come on in the room if you can. Come on in the room if you can. Okay, you guys may be up. Send us your comments. Thank you. I see you guys. Let me see you in the chat. Technology was giving us a little problems a few minutes ago. So hopefully you got our new link. Welcome, everyone. I see a couple people in the chat. Thank you so much to let us know that it's up. And we are going to jump on in because we have a lot to talk about today. So just introductions. My name is Christy Venable, and I am the CEO of Smile Therapy Services. And we are a mental health and wellness agency out of the Washington, D.C. area. And we provide all type of mental health and wellness for corporations, organizations, and also school districts. And today, we are actually doing our second LinkedIn Live. And so we had such a good turnout the first time. We thought it would be great to just continue the conversation. And so we will be talking about all things mental health. And this month in particular, we are focusing on mental health in schools, right? And so, as some of you may know, April is Stress Awareness Month. However, it's also Counseling Awareness Month. And so, I want to just celebrate all of the counselors out there. And so, I actually have two amazing school counselors with me today. And so we are going to be talking about mental health in the schools, but through the school counseling experience. So they are going to introduce themselves. We're going to first start off with Miss Bianca Hawkins. Hello, Bianca.
Well, hello, everyone. To my fellow educators out there, to parents, to mental health professionals, to all who care about the future of our world, and the young people that we're raising. Again, my name is Bianca Hawkins. I'm a school counselor. I've been a school counselor for 20 years. Cannot believe I'm saying that because I do not feel old, but that means I'm old. But yeah, so I've been a school counselor for 20 years, and majority of my time in the field has been on the public school level. However, 4 years ago, I transitioned to an independent school. That has been extremely eye-opening. I do love it here. I feel like I could be my full self here, and I think if I want to go out of the profession, I'm going out here. So I'll say that. And my tenure in the public schools, I worked on the elementary, middle, and high school level. So now I'm at an upper school independent school in Fort Lauderdale, Florida.
Perfect. Out of Fort Lauderdale, I'm sure it feels amazing there today.
Super hot. It's like 85 degrees.
That sounds amazing. First, thank you for being here. We can't wait to dive into the topic with you. And next, we have Mr. Marcus Whitfield.
All right. Good afternoon, everybody. Thank you, Christy, for inviting me. Once again, my name is Marcus Woodfield. I'm a school counselor with Friendship Public Charter Schools. It's a school system in DC, charter school system in DC. They have about 8 campuses around the city of DC. I've actually been in education for about 16 years. I started off as a general education teacher. Then I transitioned into that's with elementary. Then I moved to middle school for a year. Then I transitioned into special education, and just recently, within the last few years, I transitioned into counseling. So I've been working with kids, like I said, for about 16 years. I love the kids. I love the energy that they bring. They keep me youthful, and you learn a lot. You learn a lot about yourself, and you learn a lot about the kids, especially in the DC area and what they're going through. It's definitely a lot. For those who are not in education or who do not work with kids, The kids come with a lot of baggage, but they are resilient and joyful. And like I said, I love working with them.
Yes, thank you. So it's safe to say we have a lot of experience here in the room. And just some background knowledge, I actually started my career in mental health in the school system as well as a school counselor. So school counselors hold a special place in my heart because I definitely know, what they go through, the ins and out. So we are going to get started. Thank you for everyone in the chat. I see you guys. Mr. Marshall, Dylan, how are you? Madison, Jamie. Good to see you guys here. And so we're going to get right into our questions. We have a few questions that we're going to answer. Please feel free to put any questions that you all have in the chat box, and we will definitely leave space for them toward the end. Okay. So, our first question: how has the pandemic affected your role as a school counselor returning back into the building? And so, Bianca, you can get us started.
Okay. Interestingly enough, as a school counselor, and again, I can come from the public school and the independent school perspective, but I'll speak now as a result of the pandemic in an independent school. Our school is super academically competitive. And a lot of times our kids didn't see the need for mental health to be spoken about in the school system because they either have an outside counselor or they just want to really utilize that time during the school day to focus on what it is they're learning. And parents also didn't see the need for it to be taught in the curriculum. Well, as a result of them being out of the building for 2 years, and then us trying to anticipate what the students were going to come into the building with as far as issues, we created a survey. So at the end of this last school year, we surveyed the students to see like what is it that you guys feel like is going to be important for you to learn about and to have addressed for us to prepare over the summertime for you to have as part of your curriculum. So we surveyed the teachers to see what they thought the students' needs were going to be based off of what they observed that year prior to. And then we surveyed the students. So overall, the students talked about, them not having any not ramifications, but constraints around their time. So they knew that they were going to struggle with time management. They talked about not having interpersonal skills because they really only were in their pod of people who thought like they did, talked like they did for 2 years. So now you're going from at max 5 to 10 people to 750 kids. And then the other thing that they talked about that was a concern for them is just mental health as a whole. But specifically, they felt like the school didn't do a good job, the school as in us, school counselors, that we didn't do a good job in talking about COVID. And they said that nobody addressed how that impacted them. And they're absolutely right, because we were told not to do that. we were told to let them focus on, what is happening here. This is their time to really, get their minds off of everything that's happening in the world. So let's focus on that. So they were absolutely right that we didn't have those conversations. So really what we did is we took the time over the summer to create that programming that addressed those issues all throughout the year. And we tried to figure out what was the best way to deliver these lessons, because we couldn't have a whole grade level in a particular place to share this information, or we couldn't go into classrooms because there's a max as far as how many people could be in a classroom. So many COVID restrictions still in place. So it was hard for us to have that face-to-face interaction with students. And I think that we're still trying to to fix that now. Like we're trying to fix it now that, all of our mandates are gone. So now we're seeing more issues and having to address it in that way, as far as that face to face, those direct services that students need. So that's how our role has changed, as we are definitely going in, dealing directly with students, and the issues that they're having, and really trying to address their needs. But look where we are in the school year. So, and none of us knew what we were going to deal with once we got back, into a full-time day with kids in the building. So I don't feel like we were not successful. I just feel like we did the best that we could with the information and the constraints that we had.
Yeah, so you brought up so many good points. I really like the idea of you all doing that survey. I think it's so important for us to take heed to what our kids want, right? And need. Even though they're young, they have a mind, right, of their own. We're teaching them, we're educating them. And so they know, kind of what they need and what they want. So I'm really glad to hear that you all did that. And I will let Marcus chime in on
Yeah,
experience.
I really like the idea of the survey to get a feeling of what the kids wanted and what the staff wanted. I know before we came back into the building, I was speaking to a couple of colleagues that were on my team, and we were just wondering about how the kids were going to be. Were they going to be like traumatized? Were they going to be all over the place? They're not used to sitting still for 60-minute block periods. So we just had so many questions. But when we got in here, we kind of took it day by day, whatever the needs of the individual students were. We kind of tried to address those. We did a lot of social and emotional activities, small groups, individual sessions, to just meet the needs of the scholar. Like I said, we just kind of like tackled it one on one, because we did not know how the kids were going to act. And a lot of kids were resilient, like they fell right back in place. They followed the routine. It took them a couple of weeks, but they jumped right back in school mode. Others, like the younger kids, they had a little bit a difficult time transitioning. Some of them, that hadn't been to school. Um, but overall, for the most part, in my campus, the kids came back. They had a few issues here and there, but they kind of came back and got right into learning mode. So that was surprising for me, because had no idea how the kids were going to act. I was just thinking about the worst. Actually, I know I should be optimistic, but I was kind of preparing for kids to kind of be like all over the place. Um, but yeah, like I think the structure is the most. If you have like a strong educational team, strong support team, which we had, then the kids kind of like jump right back into learning mode, like I said.
Perfect. We actually have a question in the comments that I want us to address right now, actually. So, hold on one second. I don't know if I'm going to pronounce her name correctly, but I think it's Sathana. And she asks, or she said, having worked in educational institutions, do you think that students' mental well-being and socioeconomic backgrounds are still not taken into consideration as much as they should be? It's a great question.
Mm-hmm.
So I have my own thoughts, but what are your thoughts? What
I'll,
do
let-
you
I'll
all?
let Bianca, I'll let Bianca go ahead.
I would say I can't speak and say that every school doesn't do that. That would not be wise for me to say that. So let me just speak from my school. As I mentioned before, um, our kids in the past saw any mental health issues as being something that needs to be addressed outside of school. But what I didn't share with you is that we have an entire psychological services department here at the school. Like, I could breathe, and that's how close they are to me. So we have over 10 therapists who are at their beck and call to be able to service their needs. And these are postdoc students. They're interns, I should say. So I think that that just happened by chance with us being affiliated with the university. But I would say that we do take into consideration that we are looking at these families' socioeconomic levels and just the thought process that they have regarding mental health. And even though they are on board with their kids being helped outside of school, it's letting them know that these services here at school are beneficial for them too, because they don't have the coping skills to be able to pull from some kids don't have the coping skills to be able to pull from what they're learning in their outside therapy to that moment where they're having a panic attack, or they're going through some they have test anxiety because this huge test is going to determine the grade that's going to be on their transcript is going to be there. So yes, I think we do take into consideration socioeconomic levels when we're thinking of mental health. So I'll speak on that side for independent schools, and I'll let Marcus talk about his experience as well.
Yeah, can you see me? Okay.
Yes.
Um, yeah, I think it's depends on the school and the staff of the school. I worked at school. I primarily worked in a African American community. Probably majority of my education career, and we do take in consideration the student and their social economical status. For instance, we recognize like kids may not have eaten dinner that previous night, and then that affects their mood coming into school. And then behavior issues, is this kid really bad, or is this kid witnessed some trauma in their community? We take in all of that, we consider all of those factors when trying to educate the students. So I definitely think it is key to take in that whole aspect of the child and realize what population you're working with, and then gear your educational structure towards that. I think is very important. So if you know that student doesn't have a stable home life or has an environment that's detrimental to his learning, you definitely have to take that into consideration.
Yeah, I agree. I was just going to say, I think that although it has always been taken into consideration, there may not have always been actual services put in place on a school level, right? Because I was a school counselor, I feel like many years ago now, but back in the earlier part in the 2000s. And yes, of course, we knew that our um, families dealt with a lot of things as far as like where they came from. However, did the services match that, right? So I was the only counselor in there with 750 kids. Um, so, yes, we knew about it, but did we actually put something in place to manage everything that we had? And for me back then, it was a no, right? So yes, they knew about it, but the resources weren't toward mental health and wellness. The resources was towards academics. And so now I feel like more schools are taking it into consideration. And now, they're getting more mental health and wellness support. But I don't feel like it was really targeted years ago. I feel like more so now with a lot of the schools that I am more aware of. So great question. Thank you for that question. Our next question: what types of mental health issues are you seeing amongst your school staff in specific?
So I'll chime in. And I hate to start off with the worst case scenario, but there is a lot of depression that is happening with just our teachers, and how that plays out is our attendance rates are down like extremely as far as the staff. Like you can pretty much bet on Monday and Friday, people are not going to be here. And it was not like that prior to the pandemic. I just think their wherewithal to deal with issues is on an all-time low. And it doesn't help that the kids are struggling too. And then you have parents who are brought into it, and they don't understand that the kids are struggling, that the teachers are struggling, and it's like a big circle. So by the time Thursday comes, they're like, I can't take it anymore. And you can't be upset because you understand that things are so difficult now. I just don't know if we've done enough to help to address those issues, whether it's mental on the mental health side, whether it's pay, whether it's looking at what teachers can take certain kids being in their classrooms this year. Some of them just can't take that. And so there's definitely a lot of issues going, but the huge issue, which isn't a mental health issue, but it's apathy. So it comes out looking like they don't really care. They're just not here with us this year. But a lot of teachers too are having a lot of family issues, and they all stemmed from COVID.
Yeah.
So family members dying. At this point, we have a few people out because somebody in their family, in their immediate family, as in their household, has COVID. So it's like back on the rise again. Um, it's just they're dealing with a lot. So all we can do is give each other grace at this point and try to see what we can do to help each individual. So I think we're doing a lot more counseling for teachers as well.
Yeah. Good point. Marcus, you want to chime in?
Yeah, I mean, Bianca basically verbatim said my answer. I mean, it's the same thing here. Grief, depression, just burnout. With having the family members having COVID, or either their kids. Some of the staff have kids, and then their kids may have contracted COVID. And just overall this overall mood of the society as well. The teachers are mirror what's going on in society. So there's depression, anxiety, all of that going on in society. The teachers are, nothing different with the teachers. They exhibit those same type of qualities or feelings that main, mainstream society is feeling. So yeah, Bianca pretty much said it all. We have everything going on. Good thing with friendship, we have an employee assistance program where we do offer counseling services to our staff and employees. Now, does everybody take advantage of that? I'm not exactly sure, but we do offer it to the staff, so which is great. Um, there's a need for that, especially during this time of COVID and depression and anxiety. So um, yeah, like I said, basically what Bianca said is going on in my school as well.
Yeah. And I think a lot of people can just, really relate to that. I think we're seeing that all over, the mental health need in general, just, generally has increased, and even more so in the school system. So definitely agree. And so just to kind of go off of that, are you seeing an influx of school staff leave the school system? What are you guys seeing?
I've um, I've witnessed that as well. And I think going back to COVID, I hate to blame everything on COVID, but um, there was this terminology called the Great Resignation. I don't know if you guys heard of that, where during the pandemic, a lot of people started leaving their jobs. And so you got to think about when the teachers are in the front line. They deal with like at least 25 kids in their class, and to think about going in there and either the students have COVID or their parents have COVID, a lot of teachers, they are fearful of being in front of a large amount of kids, and so they're thinking about, is this profession, the right profession for me? So if that's the case, I do see a lot of teachers not returning to the classroom. Um, and they're used to being at home or working through Zoom, and they like the flexibility of being home and being with their family. So a lot of I've talked to a lot of staff members, and they, like I said, they do like that flexibility of working from home, not being in front of like 20, 25 to 30 kids, just being safe, keeping safe. So on that aspect, yeah, a lot of teachers or staff members are considering, not coming back into the classroom. I think
Oh,
Bianca's on
Bianca,
mute.
you're muted. You're muted.
Sorry about that.
There you go.
I was saying that I feel like my answer is two pronged in that last year for my school was really the great resignation. So we had a lot of people say, "Oh, you guys are going to be in person full time with 750 kids? We're not coming back."
Mhm.
And that's what they did. They didn't come back. So now the people that we have here, it really, you know how it is in the school system. You really don't know what's going to happen until summer hits.
Yep.
And people, there's a lot of transition that happens in the summer. So I can't speak for next year as of yet. What I will say with being affiliated with the university is if you have any idea of the concerns that we are in as educators, as far as people going into the profession, go take a step into a education course at a university.
Mm.
That will show you what dire straits that we are in because people don't want to be teachers. So one of our teachers is a math teacher at the university, and there are four adults in her math class. And we just had a huge town hall where the university was sharing the information as far as like how dwindling the numbers are in education programs in our education program affiliated with the university. And we are all seeing these articles and reading this information. So I think at the end of the year, we're really going to be able to see how affected education is. And Christy, I know we were just talking about Tampa. I lived in Tampa for some time and I have lots of friends who are still educators there. And their numbers are down in the thousands when it comes to teachers. So if we want to know how education and mental health is affecting education, absolutely this is it right here. So something has to change.
Yeah, and it's I mean, it makes you sad for the kids because if there are so many educators that are in this state of they want to get out now of this field, what does that say for our future? For the future of our kids who still need to matriculate through school, and then go to college or whatever else they want to do. What does that mean for them?
Mm-hmm.
Right? I mean, it's really scary
Mm-hmm.
in a sense to think right now there's already such a shortage of teachers and substitute shortage. You hear about these drastic number of shortages, and I know just from working in the school how often we sometimes rely on substitutes, and that was pre-COVID.
Mm-hmm.
Now you kind of need them full time, or you need to hire them as the teacher. So it's definitely something to think about, and I hopefully some of these school districts are already, they're already kind of thinking about this and thinking about solutions, because there's definitely a need for the future. So definitely agree with you guys. Next question. How has your own mental health been impacted over these past 2 years? Whoever
Marcus,
wants to
did you
start.
want to take that one?
Yeah, I'll go first. I think I've been more aware of self-care,
Mhm.
because I've noticed, like just to piggyback kind of like on the last question about, the teachers not wanting to come to work, being stressed out, anxiety with dealing with COVID with their own family and with, being inside the school, and possibly dealing with students with COVID. And everybody's just, not everybody, but a lot of people are kind of like on edge. um, and then just having, as a mental health professional, just having to deal with that, just having to be there for the staff, having to be there for the kids, definitely can take a toll on the counselor. So it's definitely important that the counselor practice some self care in their life. So um, however that looks, for you as a counselor. I definitely think it's important for, like I said, the counselor to practice self care, and be mindful that you're taking in a lot of, negative energy, taking in a lot of depression, taking in a lot of problems from the staff and from the students. So it's definitely important that I recognize that, hey, I need to step back for a second and do some activities, go shopping, browse the internet, whatever, whatever, makes me happy and relaxes me. I have to make sure I do it, because, like I said, taking in all that negative energy day by day on a daily basis, it can take your toll. And you definitely want to be there for your students, and be there for the staff if they need to come to you for anything. So you definitely have to take care of yourself to make sure you can do your job. So I think self-care for me is like number one.
Perfect.
Um,
Bianca.
for it's exactly that's. I mean, I would piggyback exactly what you said. For me, during the pandemic when I was at home, I really got into working out, and which I always loved, but I just never really made the time for. But having the opportunity to not have anywhere to go, which is now I look back at it and I'm like, I appreciate that time because it did help me to kind of reframe what I thought was important.
Mhm.
And so, like some of those things I'm continuing to do. So I still work out all the time. Now I don't miss a moment with friends. Like if it's brunch, if it's going to a concert, if it's going to church, whatever it is, the answer is always yes. I'm going to do it. And then the other thing is, I have a 15-year-old who is, I'm married and I have a 15-year-old who's getting ready to go to, I keep saying getting ready to go to college. I can't believe I'm saying that, but he's in ninth grade, but he is getting ready to go to college. So the important thing for me is like, how can I make memories? Like we have to create memories. And so that just hearing and seeing him enjoy those memories that we are creating, that replenishes what I can give out to other people too. So that's how I've been utilizing just the opportunity to show myself self-care.
Yes, and then we have a comment. Says the counselor needs a counselor too. And folks cannot take care of others without taking care of themselves first. Thank you, John. Yes, and that is so important, right? As you guys, if you both have said, we have to have our own set of self-care kind of rules of engagement to make sure that we are healthy enough to actually continue to help everyone else. I have a lot of school-based therapists, and we really recommend that they have their own therapists. It's so much going on right now. And over these past few years, that it's so important for you to be able to take care of yourself. But also for you to get different interventions within your job as well. And so that kind of leads us to our next question. And we do have a question in the comments that I'm going to share after this one. But our next question is, what suggestions do you have for school leaders to implement to improve the mental health and well-being of the school staff? Which is I definitely think, is a major one, because we're definitely a proponent of mental health and wellness as it relates to employees. And so what are some of your suggestions that you all
Um,
have?
uh, Bianca, were you going to go?
Okay, I'll go ahead.
Okay, I thought you were talking. I didn't want to talk over you.
Oh, no worries.
Okay.
So what I'll say is, I mentioned that we surveyed the students, but we did not survey the staff to see what they needed. So we were 100%. What do the kids need? What do the kids need? And I can't remember the exact phrase that people use, where it's like, if you don't feed the teachers, they'll eat the kids, and it's something to that effect. And so that's kind of what we did. We didn't feed the teachers. So I know that we're almost a year into. I mean, we're almost done with this school year, and there has only been one professional, not development, but one event that was totally for teachers to address their mental health needs, and that happened during pre-planning.
Mm.
Nothing has been done since then. Um, that is, I think we all as a school have to take the responsibility for that, because the mindset is not there. The mindset is not, how do we help the teachers so that they can help the kids? So I think that that's something that we've learned as a result of this school year. And if we do see lots of teachers leaving, that's one of the reasons why.
Mm.
So, but some of the things that we can do, and I have to make a list of things that I'm going to share with my administrators, are teachers want to be heard. It's not about money. It can be about the tangible things that you can do for them, but they really do want to be heard, because there are certain things that has nothing to do with their mental health, but that can create a better climate for the entire school.
Mm.
And so I would say for administrators to go to department meetings and to hear directly from the teachers instead of hearing from the department chair. Like, they want to hear and know how valued their voices are and their thought processes are into how to make this a better place.
Yeah.
So I think that direct transparency with that administrator is a great thing to do. The other thing is, and it shows that support. I'm sure that the idea of like morning meditation and yoga groups, just time for camaraderie and to take a deep breath, that is a great opportunity for teachers to just kind of vent and not vent. Let me be clear about that. Not necessarily vent, but to be able to have their hearts or their buckets filled during that time, and to kind of, get their mind to the place where they're able to focus on positivity and focus
Yes.
on the day ahead, or how the day ended, and to get ready to go to their next job, which is going to be their family. So the morning meditation or something at the end of the day, that would be great. And it'd be good if it was attended by not just like a small group of people, but really try to get the entire staff to participate as much as possible. Activities to promote appreciation. So it doesn't have to be, again, where you're giving out gift cards all the time. It could be a note. It can be a big thank you. It could be on a professional development day, that the first portion of the day is you're allowing them to, they're doing their learning. And then the second portion of the day, you surprise them and let them go home. So I think that we just kind of need to think out of the box when it comes to things to do to help. And all of that overall is seen as mental health and wellness, because it does, create that environment. So I just thinking of your particular staff and what it is that they need, and trying to come up with things.
That was perfect. Perfect. Marcus, you want to add anything?
Yeah, I definitely agree with Bianca. I would love to see like ongoing professional developments like throughout the year of self care activities, things that the staff can do to help them make it throughout the school year, and not just the beginning of the school year, but like all throughout the school year. And I was just listening to Bianca, some of her suggestions, some of the things my school actually does. Leave early some days. Staff outings are big, um, where the staff just gets together, on their own time, after school, and everybody just kind of like relaxes and enjoy each other's company. So that's kind of big with us, and just maybe like just positive words, positive affirmations throughout the school week. Just different things you can do to kind of boost the morale of the staff. Because, like I said before, the staff members, especially the teachers, they're like in the front line, so they get all of that energy from those kids, and they take that in and they take it home to their families.
Right.
So you definitely want to make sure your staff is taken care of. I know from an education point that we have to, make sure they know their curriculum or know their content and make sure they're good for the park exams or standardized testing. But we definitely the teachers definitely need to take care of themselves, because like we said, if they don't take care of themselves, how are they gonna be effective for the students? So yeah, anything the staff can do, anything admin can do to make, to loosen that load off of the teachers. I definitely think the admin should do it.
Yeah, and then we had a comment that I want to just highlight from Miss Hope, and she says decreased stigma, right? The stigma of mental health is one of the major issues that affect most environments. Confirm that it's okay not to not be okay sometimes, and I
Mhm.
think that is also a big one, right? Because if we're going the whole entire school year without putting any mental health and wellness interventions and workshops and different activities in place for teachers, then we are indirectly creating a space that doesn't allow them to really minimize that stigma, right? So they may not feel that they can actually talk about not being okay if we don't even talk about the mental health and wellness piece, right? If that's not a thing, if it's kind of an unspoken thing, then many of them won't talk about kind of what they're going through. And so I think that's really big, just making sure we're even having the conversations and checking in with the teachers and staff, and just saying how are they doing, besides how are they doing like with the kids, but how are they doing, how are they managing everything, how are they managing at home, right? The ones who also may have kids, or who have different family members that they have to take care of, how are they managing with everything? So I think that's definitely major. I think it's kind of, it saddens me to hear that and you guys are in two different places, but similar situations where the school districts have not put emphasis on the mental well-being of the staff. Yes, the students are definitely important, but if you have no teachers, then you have no, you can't do anything with the students. And so we have to make sure that we are really making them a priority, and making their health and wellness a priority, definitely because of everything that's going on. So you guys have hit such, great topics and gave great suggestions. I do have another question in the chat from Miss Shar, and she says, "Do you do morning emotional check-in with kids and or after school emotional check-ins at all?"
I would say yes. It just depends on the child's situation. Um, the ones who we know that we need to check in on, absolutely that happens. But I wouldn't say as an overall, we don't have a program or teachers don't do that. But on an individual basis, yes.
Yeah, same here with me. I check in with, I know certain students that are higher on my radar, so I definitely try to check in with them daily, make sure they're doing good, give them some uplift for the day, or midday. Because midday after lunch it can get a little challenging for some students. They get a little tired, so but yeah, I just try to encourage them in the morning and then try to check on them, after lunch, give them a little pep talk. We don't have an after school program, but in my school, but definitely during the day, I check in those students.
I will say that some of our teachers do that. They absolutely do that, and not just like with certain students, but with their class as a whole. Some of them will start the week with the check in, and then end the week with the check in as well. So it just depends on the teacher. We haven't like band-aided that in our curriculum, but yes.
Yeah, that's really good. And I know just from experience, as the counselor or social worker in the school, you put your eyes on those high flyers, as we call them. And so for those students, yes, you always kind of always do a check-in with them when they come, make sure they're even tempered, make sure, everything went well at home, make sure they're in a good space, get them ready for class time. So we definitely have to make sure that we do emotional check-ins for our high flyer. So I'm sure as it relates to one-on-one, we definitely do a lot of those. So let's see. Does anyone else have any other questions? Put them in the chat box. We're going to be wrapping up, but I just wanted to make sure we get through um, all of you all questions. Thank you all for joining us. I want to send an extra shout out to Marcus and Bianca because they literally just finished school and they just went into their office or or classroom and shut the door and got ready for this LinkedIn Live. So we need to give them an extra shout out because they've been working all day, had hectic days, and they still made it here to talk to all of you, just so we can really give you this information. The schools are definitely our future. Everyone, as it relates to just growing up in general, right? That you have to go through the school system. And so we have to make sure that we are continually thinking of out of the box solutions to help our staff, our school staff, with their mental health and wellness, because it's so important to have great human beings in the schools. I definitely know it's so important. Schools definitely hold a special place in my heart. Is I tell people, if you can get through the school system, right, you can get through anything because it's a lot of work. It is not for the faint of heart, but it is so rewarding, right? It is so rewarding. We have a question. So he says, this is John. He says, what would you all tell counselors going into the summer and into next year as motivation? Good question.
Self-care.
100%.
Enjoy that summer.
100%. And to utilize like that for, I know when I worked in public school, there was like the kids got out of school and then the next week the teachers came in. Use that time to prepare for next year so that your summer can be your summer. You don't think about school until it's time for you to prepare to go back into the building. It needs to be your summer. It really does.
Mm-hmm.
Yeah, I totally agree. You have to have that time to just relax, relate, release, rejuvenate, because I feel like even though you have kind of the summer, it goes so fast, and literally you'll be back, into school. I feel like within no time, even though you get like a month and a half sometimes off. So I agree. Self-care is so major. And then we just don't know what is coming next, right? Everything is still so up in the air with COVID that we just have to be on such high alert. And so I agree. I think definitely implementing that self-care is so important. So important. We may touch on some self-care things next month since it's Mental Health Awareness Month. But yeah, I totally agree. So I would like to just thank you all again. You all gave such great information. If anyone else have any other comments or questions for them, please put them in the chat. I'll make sure we answer any questions that you may have. Thank you for sticking with us today. We had a little technology issue. You love tech, but it's either on your side or not at times. But we made it through, and you guys are here with us, so we really appreciate it. Make sure you watch out for our next LinkedIn Live. It's going to be next month, and it is Mental Health Awareness Month. So we're going to try to make sure we have some great guests for you all. Oh, hold on. I see another question. And this is from Gary Cameron. And he was the teacher of the year for friendship. Hey, we're going to answer his question. He said, what are some key elements should we implement in our classroom that we can do on a daily basis to use with our students? So I'm assuming that you mean in reference to helping with kind of the mental health and wellness piece, Gary. So we can, if you guys have any comment on that, what do you think teachers can do to really kind of help the students with that in their classroom?
I think, sorry, Marcus.
Go ahead, Bianca.
I was just going to say it's all about relationships because it's going to be different for everybody. So if you, as simple as a check-in, check-out system, but then to know those individual students to see when they're struggling and be able to pick up on those tips And that will give you the end you need to not only have those conversations with those kids, but also to refer them to the services that they need.
Perfect.
I don't want teachers to ever feel like it's their responsibility to deal with the child's mental health, because it is absolutely not. They have enough on their plate, but they need to be able to recognize those signs. So the relationships it's invaluable.
Yeah. Yeah. That's
Yeah,
perfect.
yeah, definitely. That's what I was thinking too. Relationships, and definitely kind of challenge yourself and look for those, as Christy said, those high flyers. Kind of go after them, because 9 times out of 10 they have something going on that we don't know about, that they're struggling with. But try to build a relationship with those students. Definitely try to build a relationship, because once they're on your team, they're on your team. Just use them for anything around the classroom, any type of jobs, any type of duty, and just build that relationship. It's very important. They may not have a stable relationship system at home, so you know they see us like what 7 8 hours a day.
Yeah.
So it's definitely important that we build those relationships with the students.
Yeah. And then Hope put something, and this was great. I was thinking the same thing. She said mindfulness. So,
Hmm.
just having a mindful minute, right? You can call it a mindful minute, but it literally could just be deep breathing.
Hmm.
That they start to really get them centered, help them get into a better space. So that is like something great. You can do that for 1 minute, and they
Hmm.
all we come in, we do our mindful minute, and then we get started. So that's a great thing teachers can do as well, just to
Hmm.
help them kind of reset from whatever they have been dealing with right before they enter your classroom.
Yeah.
And then she mentioned again, remember what works for one child may not work for another, which is great. Be gentle with yourself and encourage taking breathers. So we're all on a same page with that. I think that's super important. And just going off of with the relationship, students really flourish off of just what they're feeling. And they know when someone cares about them. They can feel it. That's why when they have a great teacher, right, and they have a good relationship, they don't act up in that teacher class, right?
Mhm.
But if it's the opposite, you see a whole total opposite kid sometimes. So we just have to remember that when we're giving our genuine selves, to them, we're being genuine. They can feel that. So I think, yeah, I think that's another great thing. So, yep, and Mr. Cameron said he's created Mindfulness Mondays, and he was featured on ABC 7. Yes, just loving on your students, is literally an intervention. They may not get that consistent love at home. That could be an intervention all within itself. Um, and so I know personally that Mr. Cameron is a great teacher. I've known him for a lot of years. So, yeah, being just the awesome person and genuine person can sometimes just be the recipe of what the kids need. So great. Thank you guys so much. We truly appreciate you. We hope you have a great rest of your day. Um, Check us out next month. We'll be on towards the end of the month, but we'll make sure we put it up. And remember to thank a teacher or a school counselor and a staff member of the school when you see them, because it is not easy working inside of schools. And so we're going to leave you with that. Thank you so much and have a great rest of your evening. Bye, everyone.